Good afternoon everyone. We are about to start our 7th batch Cmfrp course level 1 exam, and our first participant is Sujoy Roy.
Good evening to one and all present here. Today my question is to demonstrate the crossed bilateral rhomboid stretch. In that condition, first of all the patient position will be in the prone lying. So I will be requesting the patient to be in the prone lying position. Therapist will be standing at the head end of the patient facing towards the feet, and the patient will be in a walk standing position. Now the hand placement of the therapist. Therapist will be placing both the hands hypothenar eminence over the medial border of the scapula. One hand will be a bit ahead of the another in a crossed hand position. And in this position I will be protracting the scapula towards outside and holding this position for a 30-second of hold. In 30-second of hold will be there, and then it will be released. It will be done for a 3 repetition, 30 into 3.
Our next participant is Trisha Dash.
Good evening. My topic is MET for upper trapezius. So the patient position will be supine, and therapist will sit at the top head of the patient. Now I'll request the patient to come. One hand will be at the and the neck position will be rotation of the patient, rotation of the neck. And now we will ask the patient to keep his hand over the lateral 1/3 of the clavicle, and above that the therapist will place his or her hand. Now on the the hand will, the opposite hand will be placed on the side of the neck, and therapist will ask the patient to rotate his head. Now rotate rotate your head, and the therapist will gently resist the movement, and it will be done in 10-second hold. 1 2 3 4 5 6 7 8 9 10, release. Then again it will be done in 3 times. Then after that the therapist will gently push in the lateral 1/3 of the clavicle in the downward manner. 1 2 3 4 5 6 7 8 9 10, then it's release.
Thank you, Trisha. Our next participant is Anis Chanda.
Hello everyone. Today I am going to demonstrate the sliding maneuver on the ulnar nerve. So for that the patient will be in supine lying position, and therapist will be stand on the tested side. Next, the hand positions of the therapist. One hand will be above the shoulder. The second hand just hold the palm of the patient, and we will support the elbow of the patient with our one lower limb. Next, the first step is to depress the shoulder. Next, we have to abduct the shoulder about 90 to 100 degree. Next, we have to do the flexion of the elbow. Next, the elbow will be in pronated position, and next the wrist will be extended and finger will also be in extension. If it provoke the symptoms of the patient, there it means there will be impingement of the ulnar nerve, and the sliding maneuver is mainly given to the central cause. And next we will ask the patient to lateral flex the head. Please lateral flex your head. We can thank you.
Our next participant is Upama Vadra.
So today my topic is flossing ulnar nerve. Therapist position facing the patient's face, and patient position is supine lying. Now hand placement. shoulder 100-degree abduction. Therapist will hold the palm of the patient, and on the another hand, shoulder will be depressed of the patient. Elbow is pronated, and wrist will be extended 15 times.
Thank you. Our next participant is Mashoom Akhtar.
Good afternoon, everyone. So my topic is gross upper trapezius bilateral stretch. So the patient position will be in a supine line, and therapist will be seated on the head end of the patient facing towards the patient's feet. Then patient will be in a relaxed supine position. Therapist both the hand over the patient's scapular spinous process. I will hold the spinous process. Then my thumb will be on the patient's acromion process. Then I will gently give downward and outward pressure. Patient will feel a stretch over the upper trapezius, and I will hold for 30 seconds slowly, and this will repeat for the 3 times.
Thank you, Masum. Our next participant is Swasti Sapui.
Everyone, my topic is Therabell assisted cranial base release. So I will perform the technique by using this Mulligan bed. So the and therapist will be seated on the top of the head of the patient. Bend like this, and then then it will areas point will be in the inferior nuchal line, and it will be the cuff. Then I will give traction and tension, and then mild traction using my back, and it will be holding for 30 seconds, and it will repeat it for the 3 times.
Thank you, Swasti. Our next participant is Swastika Das.
Hello everyone, I'll be demonstrating about the MFR gross bilateral traps. So the patient position will be supine lying, and the therapist position will be sitting in the head end of the patient. Hand placement will be in the acrobat. You will feel a slight stretch. Are you feeling it? Okay. We'll hold it for 10 seconds and we will do it in 3 repetitions. Then we'll slowly release it.
Thank you, Swastika. Our is Partho Sharati Kundu.
My procedure is ISTM for common extensor origin of the hand. For this patient, common extensor origin, and is 30 repetition for 3 times.
Thank you, Partho. Our next participant is Shunita Jana Ghosh.
My topic is today ISTM for upper traps muscles. For that, I will tell the patient to sit it. I will tell the patient to extend lateral flex her head. First, I will apply some lubricant for the muscle here. Will be applied for 30 times, 3 repetitions.
Thank you, Sunita. Our next participant is Shoheli Roy.
Good afternoon, everyone. Today I will be showing you how to do cranial base release. We will be supine lying. Position will be at the top end of the head. Keep our index finger over the nuchal line and over the occipital protuberance. We'll just give a slight traction towards us, and then we will extend the neck, and we will give a traction once again, and we will hold this position for 30 seconds, and we will gently release. This for 30 seconds for 7 times. Thank you.
Thank you, Shoheli. Our next participant is Rahul Upadhyay.
Muscle energy technique of unilateral sternocleidomastoid muscle. I will demonstrate on the right SCM. So the SCM attachments are the mastoid process, then manubrium, sternal, and the medial clavicle. First, I will ask the patient to rotate his head towards the opposite side, and then I will ask the patient to keep his hand below the clavicle. I will slightly extend the head, keep my hand over the mastoid process and one hand over patient's hand, and ask the patient to lift his head. We will repeat this 3 times, and between that we will ask the patient to inhale, and lastly we will do stretch. So ready? Lift your head. 1, 2, 2, 3, 4.
Thank you, Rahul. Our last participant is Bikromaditya Shahu.
Good afternoon, everyone. My topic is median nerve sliding. For this, we have to move the shoulder up to 110 degree, then external rotation, then wrist extension, then elbow extension, then depress the shoulder, then hold this position for 30 seconds, then slowly release, and we have to apply this technique for 4 times.
Thank you, Bikromaditya.